Alrighty, so welcome to this week's meeting. Today, like I said, if you want to go hop on that Google form to fill out the attendance sheet, you can do that at any time during the meeting. And then we're going to go through announcements. We have Madison here to speak about ACR homes, and then we have Dr. Kim who's going to speak about his journey with physicianship and then also mental health and burnout. And to quickly answer the question in the chat for the sign-in sheet, yes, you use just the first portion of your U of M email, the part of your name with the numbers, but exclude the @umn.edu. I can resend the form in the chat as well. So to start with announcements, just looking ahead to future meetings we have coming up. Next week is the recorded interview with Dr. Mahoney. She is an OBGYN, and she's also a really excellent patient advocate in the medical community. So we have a wonderful interview set up with her that will be shared like we did a couple weeks ago. And we did take some of your feedback, and we shortened the interview a little bit and incorporated more questions that were submitted by our members. So hopefully that is valuable to everybody who wants to watch it. And then in 2 weeks, we have our medical student panel. Right now, I believe we have about 5 to 6 medical students who are going to be joining us live on Zoom at 5 p.m. And that's going to be pretty much a free range Q&A. We will be kind of moderating questions like we did for our first meeting, but you will essentially be able to ask any questions you want about the pre-med journey, being a medical student, anything related to that. The following week, we have another pre-recorded interview with a physician. And then looking ahead to the first week of November is our final lecture series, the social impact lecture series with our sustainability in medicine speaker. And that will be a live meeting as well. Biba, are you here in meeting? I'm not sure if I saw her.
Yes, I am.
Okay, perfect.
So we are working on planning the physician networking series. So kind of if you've been here or if you've been a part of AMSA before and you've attended the pre-med dinner, it's essentially going to try to replace that. We have kind of changed the dates around, so we're planning to start the series around October 26th and then end it November 20th. So we expect there to be about 8 different events, so 2 per week, where you can meet with physicians from various specialties, and we're trying to keep the number of students present within each meeting down to 20 so that you can get that personal engagement with each physician. So be on the lookout for those RSVP links and more information.
Thank you. And we'll make sure that the slides that go out this week as well and the RSVP forms have the correct dates. That'll be updated before the email goes out. For Suture Clinic, we pretty much have a date locked down, but I'm just waiting for Sergeant West to confirm it with me. So like I said, that should be happening. As of right now, it'll be happening the weekend before Halloween. So I believe that is the 25th, 24th, that weekend. And we're hoping to have multiple groups. So there will be an RSVP form for this next week. I just need to confirm one more detail with him. So if you're interested in the Suture Clinic, make sure to keep your eye out next week early for the RSVP form. As of right now, it'll be limited to 30 seats. And then we will be distributing the reusable suturing kits that'll be sanitized and delivered in a social distance format about a couple days before the Suture Clinic. So you should have all the materials. And then, like I explained last week, it'll be live instruction via Zoom from a trauma surgeon. And then he will also be going through a couple different crisis management skills like trauma management, how to put on a tourniquet, airway management, intubation, things like that. So RCP form will be coming out in the next couple of days. Last week, I also mentioned the MCAT prep material drive. We are up to, I believe, 6 book sets, and then we also have 4 flashcard sets right now. Like I kind of explained last week, this is going to be the supplies that we're going to use as our free available MCAT studying resource that we're hoping to launch starting in November. So if you have any interest in studying for your MCAT in this next cycle as well, this might be of interest to you. So if you know anybody with materials, if you can encourage them to donate, we're looking to be able to provide as many materials to all of our members as possible to make studying accessible to all of you. So if you have any questions or you have materials that you're interested in donating, they do not need to be in good condition, nor do they need to be a complete set. And you can feel free to email me directly. At the bottom of the screen is my email.
I can talk about this. Kirsten is currently at work, so she's not in the meeting. But if you guys were here last year, we did a leadership retreat. So we're kind of doing a different spin on it this year. So we're hoping to focus more on talking about racism in medicine and how we can be leaders in our community along with that and standing up against racism. And then we're also hoping to have Barbara Goodwin, who works in CLA as a pre-med advisor, to give tips and tricks about a pre-med action plan. So we're trying to plan the date right now, but we just want to put it on your radar to keep your mind looking out for it. But we're really excited to offer it to you guys this year again. And then me again. Kay is also not here today, so I'm plugging this event for her. Right now, we are doing a food drive with MAPS. So it's ending today, so the link right there is valid, and you can go on there and donate money. And all of the money is going directly to Second Harvest Heartland, which works here in the cities and all throughout Minnesota and Wisconsin. So we really encourage you guys to apply and try to help if you guys can. And we're trying to raise as many donations for the community that we can. So there's the link, and it will be sent out in our email that we send out today.
And there's a fun gift card raffle if you are able to help donate. It doesn't have to be your money directly. Some of our members have been collecting donations from their friends and family, and then have been sending one big donation through to the website. And that can earn you a fun gift card as well as some AMSA bucks. So other than that, it's the warm heart of doing good for your community. Alrighty, Madison is going to speak to us about ACR, and I'm just going to check one more quick.
I think I can request remote control.
Perfect. That
should I try to click that?
Yeah.
Request.
Okay, perfect. And then just so you know, I'm not going to have any control then. So when you're done, I think you'll have to end the control after you're done, just to make you aware.
Okay. Okay, you'll have to let me know when I'm done.
Okay.
Let's see. I don't know. Can I click on it? I don't. Oh, here. Okay. There. Okay. Hi, everyone. Yay, Zoom. I am Madison. I am a third-year medical student at the U of M. Currently getting ready to get back into the clinic on Monday for the first time in a while. So I'm really excited. I'll be doing my pediatrics rotation. Also, side note, I'm interested in women's health and possibly an OB tract, and I've actually met with Dr. Mahoney, and she's awesome. So definitely tune in and listen to that one. But during my time in undergrad, I was at the U, majored in biology, was a member of AMSA, and obviously involved in a lot of different aspects of the community. One of the things I did to sort of prepare for medical school and applications was get this job at ACR. So I love coming to you guys each semester and kind of talking about my experience. I'll also leave my email in the chat for any of you guys who just want to ask me about pre-med, ask me about this job, any of that sort of thing. But this job ultimately is a direct care position. It gives you a ton of patient care hours. So when you fill out your AMCAS application, there will be a section for direct care or patient care hours. And depending on how long you work here, you can end up putting hundreds or even thousands of hours on your application. And I think it really helps you stand out because it's hard to get that direct care experience from my perspective. So you'll be working in a group home setting with people who have different physical and developmental disabilities. It's a super unique opportunity and a really neat perspective on how to communicate in different ways with our patients, how to be an advocate for our patients who can't always speak up for themselves. So that's what I really learned about my passion for advocacy through this opportunity, along with getting trained in a ton of other things. So just going into some of the logistical details, it's really flexible. I love doing it as a student because you can pick any shift that works for you in your variable class schedule. And then you don't need any experience. So that's really nice for people to get their foot in the door. The company knows it's a stepping stone. So they do have a lot of students working there, preparing their applications for medical school, PA school, nursing school. And then beyond that, they do offer transportation for anyone who doesn't have a car. So they have some in their parking garages around campus. And that's just a nice way of them helping us out, making it possible to get this sort of experience for our resumes and applications. And then CBS just recently got added on their ability to give their students college credit for the job as well as the internship, which I'll talk about in a little bit. So that's really neat. You ultimately sign up for independent research or direct research and or an internship elective, and then you get credit by doing this work. So that's a neat addition if you're worried about the time commitment. If you can get it to also count towards some class time, that's pretty cool. Here's just a big list of things I got trained in. It was really helpful learning about medical equipment, learning about different medications before going into med school. Just getting the littlest exposure of things makes it a little bit easier sometimes when you're learning about different things in the clinic. Along with that, there's a lot of other different therapies, general first aid, CPR. Taking vitals was one of the most helpful things for our clinical years in medical school, like already knowing how to take a blood pressure and having done it 100 times was really helpful to me, just because it's one less thing that you have to worry about. And the more of those things you can check off your experiential list, I think the more relaxed it'll be going into a clinical setting. And then the last thing is an internship. A lot of pre-med students like this because it's not common to find a medical-based internship, I don't think. So it's really easy, honestly, really low maintenance, low commitment. It's hardly any extra hours beyond the direct care that you're doing, and it's ultimately customizable. So you pick a topic or a situation or a resident that you're passionate about, you do some research and ultimately write up a paper, do a presentation. You get to know the CEO of our company really well, and he'll write you a letter of recommendation for your medical school application, which is amazing. So one less letter that you have to worry about. And I think I want to be brief and give you guys enough time. So I think that's all that I had for the ACR presentation. My email is on this slide, and I'm gonna type it into the chat right now, but does anyone have any questions about that, feel free to email me. I can get you scheduled for an interview, answer more questions about the job. Like I said, I'm available to do one-on-one Zoom calls with anyone who has further questions. And don't feel like you need to be formal with me. You can just send me an email and say, hey, I'm interested, or hey, is med school scary? And I would love to help you guys. So I think that's all I have. If you don't have any questions, I'm going to try to figure out how to give you control back. Can you request it?
Yes, I can do it actually from here. I figured it out. So perfect.
Okay.
Thank you so much, Madison.
Yeah, thank you.
Did you have, I know sometimes you hand around like a sign up sheet. Did you have like a Google form at all that you'd be interested in having us include in an email?
Sure, I can do that. I'll try to, when do you guys send out your email? Tomorrow?
Usually we don't send them out until later this evening or tomorrow. So you should have a good amount of time to put one together, or I can throw one together quick for you tonight and share the results of it with you as well.
Okay, yeah, that works. And otherwise, just attaching this PowerPoint and people can email me if they want. That's totally fine.
Perfect. Sounds good. Thank you very much.
Awesome. Yeah, thank you.
And I'm going to look through really quick. So we're going to move on then to our mental health and burnout portion of the meeting with Dr. Kim. Andrew, did you want to give a little introduction?
Yep. So Dr. Kim, he is a pediatric hospitalist here at Children's Masonic Hospital at the U. He is a lifelong member at the U of M, completing his undergraduate bachelor's degree here, as well as attending med school here and doing his residency. So without further ado, Dr. Kim.
Hello, how's everyone doing?
Pretty good.
Good. Awesome. And Andrew, we missed you at the block party last night. So.
He's also my neighbor, so.
Awesome.
Okay, well, yeah, and burnout, I think, has become a word that has become so loaded in meaning that I prefer the word resilience, and talking about how we can talk about resilience and maybe kind of turn that around to the positive. But yeah, as Andrew said, I started here in 1985 as an undergrad in physics. I did my med peds. I did medical school here, an alumnus, and I did a residency here in med peds. And actually, you do both adults and pediatric hospitalists at the U and in mostly academic settings. I love this picture, and I use this picture in orientation in medical school when we do our orientation. And I think this kind of really, like when I think about wanting to really think about that big picture of it, what is it like being a physician? And it is really about I know you all are already thinking about being the best doctor you can be, but there's other aspects of this, and this is the wonderfulness about medicine, is that you really can make your own unique mark. There are I don't know, close to 1 million physicians and healthcare providers in the United States, but each one of us has the ability to make our own unique mark on medicine, and kind of craft the job the way we want to. And really, there's almost no two physicians that have exactly the same job, and you really have a lot of opportunity, even within a specific specialty, to carve out a lot and really to explore those passions. And so you're all going to be doing something that you really love. You're already great at what you are, and you will be great at being a physician. The world really does need it, now more than ever. And at some point down the road, you will all get paid for it.
I'm not sure.
Sorry, and then I muted myself. Apologies. So there's really these kind of three things is first of all, is there's the physician identity of what kind of clinical practice do I do? So again, I do medicine and pediatrics. I'm a hospitalist in an academic setting, in a quaternary care center attached to a university. And, I work with a lot of medical students and residents in my practice. And then there's some systems aspects of what I do, which is not related to direct patient care, but impacts patient care more broadly. So I've done a lot of quality improvement. I was previously the medical director for informatics, so I helped develop the EPIC system for the university and for Fairview. And now I'm the assistant dean for student affairs in the medical school, and so very much involved in education and teaching and supporting medical students through that process. And then there's a lot of personal passions that we have that are maybe, again, not necessarily directly related to medicine, but are informed by and impact that. So I think of John Hallberg, for example. You might know him, one of our professors in family medicine, who does a weekly NPR show on healthcare. I think of physicians that I know who are musicians who play in a band, for example. There are definitely a lot of physicians who are writers, poets, artists. So there's a lot of things that we, and all of those are actually are a part of what make us the physician that we are. Next slide, please. And yeah, here we go. So this is a little bit of my identity that I'll share with you. And that's a picture of me with pre-COVID hair. And like I said, I was a MedPeace trained. My father came over here from Korea, met my mother, who's a German-Irish. I did all my education at the U. I'm very involved in education. I play ultimate frisbee and a little bit of a nerd, especially around board games and Dungeons and Dragons. And so all these are, part of my identity, which I bring with me when I'm practicing as a physician in whatever I do. Next slide. So let me tell you a little bit, and I'm sure you all have some preconceived conception of what a physician does, but let me start out by saying the reason I decided to become a doctor was as I mentioned, my undergraduate degree was in physics. I was really interested in how the world worked and really identified as wanting to be a scientist. And even in the fourth grade, I think I asked for a physics book from my father in the fourth grade for Christmas. And the reason I decided to switch from physics to medicine was I looked at what physics do, and I saw the grad students in physics, and they were all on computers in the basement of the physics building working on proton decay, just spending hours and hours on computers in this dark room. And I'm like, well, I think I want something a little bit more interactive with people. So that's how I kind of then made a jump over to medicine. And unfortunately, I am here to tell you that much of my time as a physician is in front of a computer and writing, but it's definitely a very different from being a physicist. But probably a third of my day is writing, sitting in front of a computer, right? When I'm doing clinical practice. So I spend about a third of my day seeing patients, a third of my day documenting, and then a third of my day just doing all kinds of other things related to being a doctor, answering pages, talking with other physicians, talking with nurses, talking with care coordinators, social workers, respiratory therapists. So there's a lot of things that I'm doing when, 2/3 of my time I'm not actually with a patient in my role as a hospitalist. And again, a lot of variability as a physician. But when I'm working, I usually do a 7-day in a row shift. I'm usually working about 70 hours or so when I'm doing those shifts. I'm a little bit less when I'm working with residents and medical students, and a little bit more when I'm doing hospitalist week on my own. But for me, then how that works out is then as a hospice the full-time hospitalists will work every other week. So they do 1 week on, 7 straight days, and then 7 straight days off. So that's where the kind of balances out, where you do that balance. Although I don't really have the other week off because I'm doing my assistant team work during that time. But that's just kind of an example of how things work. There's always these sort of times when you're really busy and times when you're not as busy. Next slide, please. And so, definitely that documentation, I've made sort of reference to that already. I think there's one other picture, if you could advance to the next. Thank you. So, definitely the documentation part. And, the way things go with, I have some young kids, as you might have seen in the previous photos. So I often do my documentation like between 10 and midnight. So that can kind of be a drag. But I love being in the hospital. I love working with patients. I love working with all the different people especially in the academic health center. And then definitely a high passion for working with students. And these are students a few years back who have their match envelopes that's telling them where they're going to residency, which is sort of the culmination of the whole medical school process. So, those are my real passions. Next slide. So I'm going to start talking about the challenges of med school here, and I don't know if Madison still stayed on. And love to hear her thoughts on it as well. And everything is different now with COVID, but this is sort of what, if the 30,000-foot view of medical school, trying to encapsulate it in sort of how it progresses. And there's these 4 years which each have a very unique flavor to them. Year one is, you feel very much like a student in year one. A lot of lectures, hopefully, we're moving more to more interactive, but you're really building that foundational knowledge. Year two is a lot of pathophysiology and pathology. So you're really talking about diseases, which is kind of a cool switch, but still mostly a classroom type experience. Then there's a big jump between year two and year three, where now in year 3 and 4, you essentially become an apprentice in the clinics, and you're seeing patients and you're given responsibility for patient care, and you're working with a team in a hospital, in a clinic, really providing care. And then, in the 4th year, you've finished most of your requireds. You're now looking at those electives. You're thinking about what are those things that you're going to want to, for your residency. Maybe starting to think about some unique areas that you want to kind of fill in before you start residency. And as you go through these 4 years, you can see here there's this kind of slow move from sort of more basic foundational lectures to being more of a clinician, although there's, you never stop learning in medicine. And then there's these big things, milestones that happens along the way. A few of them are listed there, step 1 and step 2 CK, USMLE. These are national exams that every student medical student across the country take. I am happy if you didn't know this already, that USMLE step 1, which was probably the biggest exam in the medical school 4 years, is going to pass fail. And when you all enter medical school, that exam will be pass fail for you, which is something we've been fighting for a long time. And then all through this, you're going through this process of trying to decide what kind of physician you want to be, and then how you're going to use that to get a residency position in what's called the match. So there's these transitions in through each of these years, because each of the years is a little bit different. There's these transition as you're moving from really a student perspective to a clinician perspective, really a professional perspective. And along the way, you have all these milestones. And as you can imagine, with these transition and with these changes and with these increased responsibilities, increased demands, that there can be stressful moments during this time. So we go to the next slide. So I want to step back and talk a little bit about, and probably I think there's been a lot of talk about burnout lately. So go ahead, yeah, and put these up there. Thank you. So emotional exhaustion, depersonalization, and decreased sense of accomplishment are the 3 aspects of burnout, the three components of burnout. And certainly when articles have looked at, where and what kind of burnout people who are in medical school, who are in residency, and who are practicing physicians, it's a little bit different through each of those stages. And actually for medical students, it's that decreased sense of accomplishment, especially in those first couple of years, again, where you're coming in with that really high enthusiasm and empathy, and you're dealing with a lot of exams and lecture content and less clinical work, that it can really result in kind of losing that big picture toward and having that sense of accomplishment. And in a study, this was sort of a landmark study that was actually done in Minnesota, and it was a joint venture between Mayo, the University of Minnesota here in the Twin Cities campus, and the Duluth campus. 45% of medical students had some symptoms of burnout sometime over their 4 years. And some of the factors that were related to that were having significant life event, especially a severe illness, either in oneself or in a family member. Those who had burnout did have, in a survey of a quality of life, lower levels of quality of life. In the first 2 years, it was really this disconnect, feeling like there's this disconnect between faculty and staff. And then finally, in years 3 and 4, longer hours and being exposed to residents and faculty who may be burned out themselves. Now, I certainly hope we've addressed a lot of these things since this survey came out. We've actually reduced the amount of contact in years 1 and 2 by almost 20%. And we have moved away from sitting in a large lecture room and just watching people speak to having more active learning. And we're continuing that process. And with the new Health Science Education Center, we're really hoping to ramp that up especially when we're back into actual interactive courses, to have more of an active learning, which I think is, from an adult learning perspective, very positive. And then in years 3 and 4, we've done a lot in terms of increasing the amount of time off students have, that students are no longer working 80, 90, 100 hours a week. In fact, our averages are more like 65 to 70 hours per week, which is, 15 to 20 hour per week reduction to what students were doing before. And I think we're having a lot more awareness about providing community and really supporting students through that time. So we've got the next slide. Stress is a really interesting thing. So stress is obviously not necessarily a bad thing. In fact, if we've experienced very low levels of stress, you might have experienced this in the class where you were not challenged at all. That it was really a basic class, and it was really hard to engage in a class when you're really feeling like it's at a level well below you. And then as we're sort of challenged and engaged, we get pushed into a comfort zone where we really feel like we can really perform well. And then I'm sure you're all familiar with this, being pushed out of your comfort zone as a way of really trying to increase the amount of learning, increase the performance. And as you can see from this slide here, that as the stress level slowly increases and pushes you out of the comfort zone, that there is this sort of peak in performance. Now, we often think about the downside of stress, which is when that stress gets unmanaged, which is really more distress than stress. Then you start having a negative impact on performance, especially if this is severe stress or constant stress, which can lead to exhaustion, ill health, and burnout. But I think the really good news that data supports, if you go to the next slide, is that this curve can be bent. That there are ways to both increase your performance in response to stress and also mitigate some of those downsides of stress that might occur, the negative aspects of stress, through various processes of stress management. And so, that's what we really aim for. And medicine is a stressful profession. As I mentioned, working 60, 70 hours, maybe sometimes more at a week. Residents are often working 70 hours a week, very consistently. And so you do need to be able to use these stress management skills to really perform at the highest level and provide the best care for your patients and take care of yourself. So how might we think about bending the curve? If we go to the next slide. And think about it in these three kind of areas. Really modifying the learning environment to make sure that it's safe and effective. To really be involved in supportive relationships, to be part of a community. And then to have your own self-care approach that really, and everyone knows probably, at least to a pretty high degree, what really works for them into their self-care. And when I think about this is really a partnership between the system and individuals to make this happen. So you have to have an environment where you're provided an effective and safe learning environment. You have to have good, supportive colleagues, teachers, a system built that allows you really to thrive. And that only happens when you can engage in that and provide feedback, and that learning environment can respond to that feedback and alter to make it a better environment for you. Obviously, supportive relationships and community also needs an assistance from so if you're working 100 hours a week and you don't have time to spend with your family, then that doesn't allow you to have a relationship. And when I work in the hospital, there are a lot of opportunities. There's areas that we congregate in order to interact with each other, that we have the sense of community, and we take time in and around our patient care to have a community. And then again, the self-care approach. Yes, you need to do your own self-care approach because you know what's best for you. But again, you need to have that opportunity to really engage in that self-care approach, and maybe have some incentives or learning education around that in order to do that most successfully. And then that provides a sense of belonging, increases your capacity and self-efficacy, which ultimately leads to well-being. Next slide. And so, examples how we do this in medical schools, that we really provide a network of resources. We have academic advisors, which I think probably many of you are familiar with in your undergraduate, but we're actually the second medical school in of the country to provide a full academic advisor program. And you could definitely be interacting with faculty, specific faculty advisors, physicians who help guide you, the medical school administration, and other resources that really help you do this, that are really going to hopefully provide that developmental approach for you to really learn and work the best and become great physicians. Next slide. You definitely want to have a huge community. This is a celebration of our MedPeds residency program with faculty and residents. You can see there I am with, again, a frisbee disc in my hand. So, again, I have this extended community that when I'm going to work, I am not going to work to do an X job. I am going in with a community and with individual relationships with many of these people in order to be successful. And next slide. And finally, it's a lot about grit. And grit is a really interesting thing. If you haven't read this book, this book, I think, is a very powerful book, and I think everyone should read it. Dr. Duckworth actually spoke at a meeting that I was at a couple of years ago. And this is really interesting, this idea of grit and grit is different from resilience. Resilience is sort of bouncing back in response to severe stress or to stressful situations. Grit is more of a longitudinal planning. For example, Dr. Duckworth talks about people with grit make sure they get 8 hours of sleep at night. They don't stay up late to kind of power through things. They know that they need, X hours of sleep per night, and they make sure they get that. People with grit tend to be very proactive. They tend not to be procrastinators. They tend to think about a project and break it down into steps and start right away on step one and get to the other steps later. And they do all the things that they need to do in order to support their wellness, and so they are functioning at their highest level at all times. And grit doesn't mean that you lock yourself into one approach. Gritty people do make the decisions to jump tracks and follow a different career, and they realize that through a self-reflective and mentor process, they make decisions about where they really is the best kind of career for them, and where they can do the best, where they can do the most effective work. And I think next slide is probably my last slide. And so when we also think about in terms of this, more broader think of well-being, this is from the Center for Spirituality and Healing here at the university, which is an amazing resource. And they really think about these 6 domains of wellness where you think about your own personal health and keeping that personal health. Again, the concept of having really strong relationships and community. But there's also this idea of security, and security is financial security, physical security, other levels of security. Having an environment that's, again, suited, and this is, your personal environment. Do you have plants? The broader environment around you, are you able to take walks and really enjoy nature? And even more broadly thinking about, the environment of the earth as a whole. But purpose for me is sort of the biggest one of all of these, and I think the one that can really be important. And again, going back to my first slide about really thinking about what's driving you. What is it that you really want to have? What kind of doctor do you really want to be? Both all 3 in the kind of doctor, patient care doctor, the kind of doctor you want to do in terms of giving back to the system and improving the system, and then also exploring those personal passions. So you really kind of need all of this in order to really be truly successful. Next slide. So thank you for allowing me to do this. And I think I have the next 15 minutes to answer questions.
Yeah, and the other thing that we could do too is just, if there are a couple quick questions, otherwise we can break out into some small groups too and have a little discussions about, personal stress management tips and things like that. But if there are a few questions, if anyone would like to speak up or put a question in the chat right now, that would also be awesome.
I had a question. So how has the pandemic affected physician burnout?
Yeah, that's a great question. And again, because COVID and the response to COVID has really affected different physicians differently, it's been really hard to tell. Certainly, we've seen increased amount of people responding to burnout, the burnout surveys at a higher level, and depression screening seen at higher levels. It's interesting, when I've been on service and I talk about that community part, that's actually the part that was, for me, was kind of a little bit hardest to deal with COVID, is in the hospital now, while we're all wearing masks and goggles, and, I used to not like scrubs, and, I felt like I'd rather just kind of wear, some business casual clothes, but everyone's wearing scrubs now. And so you do kind of lose that sense of individuality. And because there were fewer people in the hospital, and patients aren't allowed to have as many visitors, that it really did change the dynamic quite a bit. And then for a while there, we didn't have any medical students. Now, the last time I was on, we have been loosening up the restrictions on patients having visitors, and medical students have now returned to the learning environment. And so that, I think that has improved that sense of community. Certainly for some people, there's this refocus on this purpose of really dealing with COVID, and doing that. And for some people, it actually, I think they um, are really embracing that aspect of it. Others, it's a little bit harder. Um, People are working, a lot of primary care doctors were working via Zoom and having Zoom appointments, which I think they value that interaction with the patients. But again, it's not that same experience of being able to walk into a clinic room and really have, maybe a more informal conversation. So, I think it'll be interesting to see once we do the reflections back on all of this. Obviously, if you go to New York or some of the really hot spots, the sheer, when I read about what happened in New York and Detroit and New Orleans and LA, initially some in Seattle, it's really just horrifying. And you can, obviously you can see where the providers there were really overwhelmed. I think from my perspective, Minnesota, we fortunately have not had the medical system being overwhelmed in that way. And so it's a little bit different, but I think it has changed medicine. I hope we get back to a point where we can really interact more directly with our patients and with each other. And I think really learn from this experience going forward so that we can provide better care for ourselves and better care for our patients.
I had one really quick question. Going back to your mention of the pass fail for the step 1 exam, I think holistically, most of the people I know in medical school are very excited about it. But I have heard a couple students specifically in DO programs that have expressed a little bit of concern that they saw that as an equalizer for them. And I know there's a lot more momentum in the direction of people understanding the level of equalness, I guess, between MDs and DOs. So there's a little bit less of a stereotype.
Sure.
But do you I guess, what's your thought on that perspective? And do you see that as being a possible consequence of it becoming pass fail?
Yeah. So, well, let me first step back and talk a little bit quickly maybe about why I thought step 1 should be pass fail, which is step 1 is a written exam where you go to, previously a Prometric center or some testing center, and you sit there for 8-9 hours and you answer a couple hundred questions, and you basically are explaining your medical knowledge. There has never been a study that associated performance on an MCAT exam with clinical skills or how good of a doctor you're going to be. So it is a fallacy that that this was being used in a way, and it was really being used out of convenience. So for example, our residency program in internal medicine gets about 2,500 applicants for about 40 positions. And so then that's not atypical across the country, especially in more competitive programs. So step 1, which was never intended to be designed to test clinical skills more broadly, was being used as a way to whittle down an application list to something more manageable for program directors, which is not the way it was intended. And again, has no relevance to clinical skills. But we are, as you're saying, we're taking away something programs used, and especially, Minnesota is going to be less likely to be less affected because, we have a good reputation, we have a very high match rate. When we survey programs where our residents go to, they say our residents, that our graduates are great. So we're probably not going to be affected by something like that. And I think, less so. And I hear programs who might have less of a reputation, especially DO programs. But I think it's going to be really reliant on the medical schools, us, to say, This is how we distinguish this medical student. This is how we can describe the medical student's experience through the 4 years. And this is why we think you should consider this medical student for your residency program. So, what does that mean? That means thinking about other ways of how we assess students, how we know that students are on their path to becoming a great doctor. What are the other things, what are the other opportunities students have to show their interests, those passions, on the system level and their individual passions? And how do we craft a sort of like a portfolio for students to really show that to program directors? And that's going to mean more work for us. It's going to mean a little bit more work for program directors because they won't have that easy checkbox to say, okay, if you don't get 220 or above, we're not even going to look at you. But I think in the long run, it's going to be better for medicine. I think it's going to force medical schools and DO schools to think more about how they assess their students and how they pass that information on. It's going to help students think more about what's really important to becoming a doctor and not just taking an exam. And again, I think residency programs really want people who are great, have great psychosocial skills, who are great, have great bedside manners, who work well with other disciplines. So they really, really want this kind of information too. I don't think no one really says, wow, I really love using step exams previously. So I think in the long run, this is only going to be better. It's going to be a lot of work. Luckily, we have about 5 years before we have to 4 or 5 years before we have to really think about that. But I think we're already making step towards that. Again, changing the education environment to really show that, and I think we'll be ready for that when the time comes.
Perfect. Thank you very much.
Any other questions from anyone else in the group?
So let me maybe just close and say it is, being a physician is a demanding job. Things like Epic and some of the system issues can really be barriers and be frustrating. But I can tell you, I still love. I've been, practicing for decades now. I still really love medicine. I really look forward to my weeks when I'm in with patients. It's an expensive process, but you are well rewarded for it in the long run. I think the return on investment is pretty high, relatively speaking. You could definitely find other jobs that you can make more money faster, but definitely there's the salaries are good, the benefits are good, the flexibility is amazing, and I think most physicians would say that they made the right choice in doing that. So I think you're all on the right path, and I look forward to working with you all in coming years.
Thank you very much for joining us. I know we can't give you an audible round of applause, but I think there's a little emoji we can give for you.
Thank you.
We do have a couple more minutes for our members to do a little bit of a debrief discussion. I'm going to stop the